Greetings. My name is Dr. Lipi Roy. I'm an internal medicine and addiction medicine doctor, former instructor at Harvard Medical School, and former chief of addiction medicine for New York City jails, including Rikers Island. Today, I'd like to talk to you about the difference between detoxification, or detox, and maintenance. What exactly is detox? Detox basically refers to when a patient or a person is slowly weaned off their dependence on opioids using medication like methadone or buprenorphine. Detox, the process of detox usually it can vary from as short as 3 to 5 days to longer tapers, like 10 to 14 days, possibly longer. But here's the thing. Detox is temporary, whether it be 4 days or 4 weeks. It's a temporary fix, and it is not treatment. Here's the key fact about detox. Relapse rates with detox alone are over 90%. That means after just a simple detox, people will relapse, they'll use again, they may overdose, and they may die. Detox is not treatment. In contrast, maintenance refers to a person being on long-term medication to treat their long-term illness, known as addiction. The benefits of maintenance therapy is that maintenance medications decrease cravings, they decrease withdrawal symptoms, they increase a patient's comfort level, and they increase they repair they prevent relapse they prevent relapse by acting on the brain circuits and helping them to return to normal function. In other words, maintenance is really the path to recovery. Medications like methadone, buprenorphine, also known as Suboxone or Subutex, Sublocade, allow patients to enter recovery, long-term recovery. Detox alone bad, maintenance good. For more information, you can read my articles on Forbes, or you can follow me on Facebook, Spices for Life MD, or follow me on Twitter at Lipi Roy. Thank you very much. Be safe and be healthy.